All right, Doc. So here's an example of the beginning and an end of a doctor's report. And this is so critical to get them in state and get them thinking and knowing that they're going to be a patient. You got to sell them right from the beginning. You got to sell them from day one. So in day one, the exam, you've got to get their goals. You got to understand why they're there, what the purpose, what their why is. Their why isn't to lose weight. Their why isn't to get rid of some pain. Their why is they want to live life again. They're tired of getting up every day and being in pain. They're tired of going to work in pain. They're tired of coming home and being exhausted. They're tired of taking drugs. There's some bigger why. They want to be able to play with their grandkids. So you got to get that from them on day one. So when I begin a doctor's report, you got to come out and you got to have authority, and you have to get them in state, because they're thinking this is a sales pitch. This is, what are we doing up here? What are we doing in this room? Well, aren't you just going to show me my test results or exam? Just show me the price, doc. Just show me the price. So what I say is, hey, welcome in. This is the most important thing I do as a doctor, and I'm always standing, and you have to be in state. So make sure you get yourself in state before you do that. And I say, welcome in. This is the most important thing I do as a doctor, and you're here for two reasons. One, we know we can help you based on your test results in the exam and what we covered on your first visit. We know we can help you. And two, you're committed to that change. You're committed to wanting to get the results. If you weren't committed, or we knew we couldn't help you, you wouldn't be here today. So that's why you're here. You have to understand what this office is about and how we're going to change your life, because your life is about to change here in the next few days and few weeks. So we base your program on your goals, but our goal in our office and for you is to transform your life and your family, so you don't have to take drugs, depend on doctors, hospitals, surgery, and end up in a nursing home in a diaper. But you can live a vibrant, healthy life. Who would like to have that? Get them to raise their hands. So that's the beginning, and then I get in, and then you can start your slides, you can start your PowerPoint, whatever you do from there. But you got to get that. You got to start up that emotion, saying, "Hey, you're in the right place, and your life is about to change, and it's only going to be a few days and a few weeks, and we know we can help you." So let's go into this. So as they go through the whatever your slide presentation is, whatever your PowerPoint, whatever your explanation of what your office does, you're setting that up that they're excited. Hey, they can help me. And I do have good goals. I am committed, because you just told them they're committed. So as I go through that, one powerful thing at the end that I've implemented that seems to work really well is I say to them, and I have a slide up there with my family, and it says, is your health worth the time, the effort, and the money? And so I say to them, because their whole thing is, how much is this going to cost? Is my insurance covering everything? How long is it going to take, Doc? Questions like that. How long do I have to be here? Are you going to crack my neck, or can I just buy a pill? They have no idea, so hopefully they have a better understanding. And I say to them, look, it takes time, effort, and commitment, and it costs money to do our programs. You know that. And insurance doesn't like to pay for this end. Guess what's over here? If you don't change your life, if you don't get your health back, then you have to depend on the medical system. You're going to spend time, money, and effort in this system. So it's either one or the other. If you work hard at your health and you spend time and money here, and you get your health back, and you get that vibrant, supportive health system that you're dying to have without drugs and doctors and surgery, your health is going to be dependent without drugs. So you put that in. Once you get it there, it's easy to maintain. But over here, if you don't take care of your health and you're depending on drugs, doctors, and surgery, it never gets easy. And it gets more expensive. You know how deductibles and co-pays and insurance works. It's getting worse every day, every year. So you're either putting in one effort or the other. So tonight, you're going to make a decision. And you know right now whether you're going to go through with this or not. You have to, based on your health, based on your goals, you make a decision tonight. We're starting care tonight. So you have to have some authority there to say, look, we're going to start tonight. This isn't going to be, let me think about it. You may even want to say that. And tell them, you may be saying to yourself, well, let me think about this. And there's no time to think. You've been thinking about this and having health problems for years. Tonight's game time. Tonight is let's start, let's get going. And when you tell them that, they, yeah, I guess it is game time. And I've had people shake their head and be like, yeah, you're right. I've been waiting long enough. It's time to man up. It's time to dish out the money and say, I'm in. So you say, because if they don't do your program, they're doing this. They're doing the drugs and the doctors and spending tons of money over here, getting worse every year. So that you may even want to say, some of you may think that, well, I may do nothing. And if you do nothing, you're going downhill. You can't do nothing and maintain. You're going to go downhill. Every day you're getting worse. Every day you're moving further away from health. Is that what you want? So if you wait 3 months, 6 months, or a year, it's going to cost more time. It's going to cost more money and more effort to get you back to even where you are now. So don't waste time. If this is the place for you and you know it, start tonight. We're going to start your plan tonight. You're going to get adjusted tonight. And your life is about to change. Who would like to have a new life in about 3, 4, 5 days, in a few weeks, a few months, have a life transformation? Yeah. So let's get going. Boom. And then you get downstairs. Don't end on a soft note. End on something strong. End on something with authority, and be done with it. But pull up that money thing. They're curious about money. They're curious. Does my insurance pay? So when you do go downstairs, and we'll cover this in other videos, when you go through a financial and they say, oh, I thought my insurance would pay. Yeah, we thought so too. They don't. So here's the price. You know, it's because you already dealt with it upstairs. You already dealt with it in your report. Hey, we know insurance is going to cover, so deal with it. This is your life. This isn't your insurance life. You got to have good health for your kids, for your life. Where do you want to be 20 years from now? In the pits of hell in a diaper, crapping your pants, sitting in a nursing home like this? Or do you want to be alive and vibrant? That's your choice, and it starts tonight, guys. And that's how you talk to them. You be real with them. Because if they don't do something, they're going over here. And they know it. In fact, they're already 1 foot in there. That's why they're at your office. They're at our office. They're not at our office because they have great health. Their health sucks. They need an answer, and no one's ever given them an answer. They're looking for you to take authority and tell them exactly what to do. Tell them you can help them, and tell them you're starting tonight. The more authoritative you have, authoritative procedures and talk, the more authority you give, the better results you're going to get every single time. And people will even say to you, yeah, I got to start. And they don't even know why, because you told them. And yeah, I guess I can't do nothing. I got to do something. You're right, Jim. So let's do this. All right, I guess I have to, because you told them in your doctor's report several times. You got to keep throwing that in every time. Because you're a salesman to sell their health back. You're a salesman to sell their life back so they don't get into the pits of hell depending on drugs, doctors, surgeries, and end up in a diaper. So hope that helps. And practice that, but just implement it. Practice without implementation is nothing. It's garbage. You have to implement. So just start adding it in. Practice before and add it in. You have nothing to lose.